Welcome along to this explainer. Look, I know working families here at home just need the hard facts right now, so we're going to skip the preamble and get straight into it. For everyone waking up to the news and worrying about what this means for our own shores, here is the absolute most crucial number for Ireland today. Two. Just two. Two Irish women who were passengers on that very cruise ship have landed safe and sound at Baldonel. And honestly, the really brilliant news, straight from our interim chief medical officer, is that both women are in very good health with absolutely zero symptoms. They are home and they are well. Grand news to start us off. Section 1. The MV Hondius outbreak. Okay, let's dive into this. To understand why those Irish women had to be evacuated in the first place, we really need to zoom out and look at the massive global situation that unfolded aboard this ship. The official tally from the World Health Organization shows the very real human cost of this outbreak. We've got 8 people from the MV Hondius who've fallen ill. Out of those, 6 are confirmed to have contracted the virus. And, tragically, 3 people have passed away. That's a Dutch couple and a German national. It's a desperately sad reality, and it's exactly why international authorities are moving with such incredible speed right now. Moving on to Section 2, tracing the virus path. How exactly did an isolated outbreak turn into a massive international incident right off the coast of Tenerife? Well, let's track the journey. Just look at the sheer scale of this journey. The MV Hondius sailed all the way from the southern tip of Argentina, making its way across the South Atlantic to the Cape Verde Islands. But the crucial date you need to know here is May the 2nd. That's when the virus was first detected in Johannesburg, South Africa, in a British man who fell ill. What's deeply concerning about that, though, is it happened a full 21 days after another passenger had already died. Following that detection, the ship left Cape Verde and finally anchored near Tenerife in the Canary Islands, which is what triggered the massive evacuations we're seeing on the news. Section 3, hantavirus, the hard data. Now, I know exactly what you're thinking. After the last few years we've had, the very moment we hear words like virus and quarantine, this massive wave of COVID fatigue just washes over us all, doesn't it? Working parents, families just trying to get on with their lives, nobody wants to hear about another outbreak. So I promise we're going to stick strictly to the hard science here and cut right through the noise. Now, what's really interesting about this slide is the exact nature of what we're actually dealing with. Hantavirus is not COVID. It is a virus that's usually spread by rodents. Person-to-person transmission is incredibly rare and typically only happens in instances of very, very close contact. Specifically, they've detected the Andes virus strain here. The core takeaway for you at home, the thing you really need to remember, is that the transmission risk is totally different. It does not spread easily through the air when you're popping into the supermarket or sitting in your workplace, the way we saw during the pandemic. But despite that much lower transmission rate, there is still this incredibly intense, highly coordinated global operation underway to get people home. Nations are literally pulling out all the stops. France has evacuated 5 people to Paris, 1 woman tested positive after starting to feel a bit unwell, and they're already tracing 22 contacts. The United States has 17 citizens evacuated, 1 has mild symptoms, another tested mildly positive, and out of a complete abundance of caution, they actually used aircraft biocontainment units to fly them to specialized centers in Nebraska. Meanwhile, Australia, New Zealand, and the Netherlands are finalizing their own charter flights in quarantine capacities as we speak. Which brings us to Section 4, panic versus reality. Because, look, seeing biocontainment units plastered across the evening news is bound to cause some alarm. So let's address the elephant in the room right now, especially for us here in Ireland, and actually assess the real risk. And this brilliantly illustrates the massive divide between those strict protocols for the passengers and the actual risk to your family. For the evacuees, the WHO is recommending a whopping 42-day quarantine in specialized isolation. But for the general public, experts are actively urging calm. They're reminding a very scarred public that this virus is far less contagious and poses little to absolutely no risk to the wider community. The extreme measures taken for those passengers are exactly why you can feel completely secure going about your day. And that highly proactive approach is echoed right across European authorities. The French health minister, Stéphanie Rist, summed it up perfectly. She said the key is to act early and break the virus transmission chains. They've already introduced decrees to step up isolation measures for those contact cases, and she's assured the public that they've got plenty of masks and tests ready to go. They're basically locking it down locally straight away to protect the wider population.
And you have to say fair play to the Spanish authorities as well. Their health ministry confirmed that all prevention and control measures have been strictly applied. They didn't even let the ship dock in the usual manner. Passengers were meticulously evacuated via small boats at Granadilla port in Tenerife, which firmly cut off any chance whatsoever of the virus spreading into the local community. They took absolutely zero chances.
All of which leaves us with this really massive, thought-provoking question to finish on. When you look at how swiftly nations deployed biocontainment flights, 42-day quarantines, and specialized isolation decrees for a virus that experts explicitly say poses little risk to the wider public, have the harsh lessons of the 2020 pandemic permanently transformed how the world responds to viral outbreaks? It certainly seems like the days of taking a wait-and-see approach are well and truly behind us. Thank you so much for joining me for this explainer. I really hope it gave you the facts you need.